Hi everyone, it's Jasmine, and in honor of Epilepsy Awareness Day, today's video is going to discuss epilepsy, what it is, the causes of the condition, and how we can support those living with the condition. So I hope you learned something from this video, and let's get started. So what is epilepsy? Epilepsy is a neurological disorder that's characterized by recurrent seizures. Epilepsy results as brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. It affects people of all ages, genders, races, and socioeconomic backgrounds. There are different types of seizures that an individual can experience. Some of these types include generalized seizures, which affect both sides of the brain, focal or partial seizures that affect one part of the brain, and then other different types of seizures, including absent seizures and tonic-clonic seizures as well. Now, in many epileptic conditions, the cause is idiopathic, meaning that the cause is unknown. However, there are different causes of the condition that have been identified and include a genetic predisposition to the condition, a brain injury causing the condition, other brain conditions such as a stroke or a tumor, or infectious diseases, including meningitis, HIV, and some parasitic disorders. Now, early identification of any signs and symptoms of epilepsy, including seizures, loss of bodily functions and controls, and so on, can allow for early diagnosis and in turn early treatment, which is crucial in allowing for effective management of the condition. And different ways to diagnose epilepsy exist, including having a medical history taken, as well as a physical examination done by your doctor, and then different brain imaging tests, including MRI or CT. If an individual is diagnosed with epilepsy, there are different treatment options that are available to them, including different medications, potentially surgery done on the brain, or vagus nerve stimulation. Vagus nerve stimulation works by having a device implanted into the patient's chest that then stimulates the vagus nerve to regulate the electrical activity in the brain and minimize the experience of seizures and other side effects of the condition. Epilepsy can have a significant impact on the patient's life from day to day, and overall stigma that's associated with epilepsy perpetuates misconceptions, discrimination, and social exclusion, posing significant challenges to the well-being and the quality of life of those living with the conditions. This includes the limitations that are on driving with people with this condition, as they are not allowed to drive due to the potential of them having seizures, limitations on them being employed and included in social activities due to concern about their condition and their participation in these events, and as a result, the emotional impact that this can have on the individual and caregivers of the individual. It's for this reason that supporting those living with epilepsy is so important, and there's different ways in which we can do this. Two of which include educating ourselves on the condition and how we can support those living with the condition, and raising awareness in our communities and starting conversations about the condition so that it's better understood by all. On the other hand, we can help to create safe environments, both emotionally, mentally, and physically safe for the individual living with epilepsy, and part of this involves recognizing the signs of a seizure and how to support individuals through a seizure. So there are steps to take when an individual is experiencing a seizure so that we are able to provide them with the best support that we can and to protect their safety. The very first step is to make sure we are staying calm throughout the entire event, as they require our support to make sure that they are kept safe. The step 2 is ensure safety, which can involve a lot of things, but what I mean by this is to make sure the environment in which they are having a seizure does not have any hazards, any sharp objects, anything that they could hit their head off of, anything along those lines that may become dangerous to them. Step 2 ties into step 3, which is to protect the head. If you do identify that there are hard surfaces or something that the individual may hit their head off of, putting a pillow down or something soft is really helpful and important. Step 4 is to time the seizure, as this is very useful information to determine whether the individual needs to seek additional medical help. Step 5 is to stay with the individual to make sure that they are okay and they do not need additional medical help, or if they do, again, calling that help. Step 6 is to position the individual on their side in case they are throwing up. It's important for them to be on their side so they are not at risk of choking. Step 7 is to provide reassurance. Although it may seem like the individual is not mentally present or there during the seizure, they can still hear you, and it's important for you to use your voice to make them calm and allow them to get through the seizure and the epileptic episode. And finally, step 8 is to seek medical attention if needed. And circumstances in which this is needed is if a seizure lasts more than 5 minutes, if they experienced any injury during the seizure, or if they are having a seizure for the first time. So there you have it. That is my video today on epilepsy. I hope you all learned something about the condition and how we can support those living with the conditions. And I want to thank you very much for watching, and I'll see you soon with a new video.